would like to start this presentation reflecting on how many times we have heard someone say, breastfeeding is hard, or I want to breastfeed but I don't know how, among many other phrases that demonstrate there is a need of a lactation support system. I am Claudia Sofía Díaz, and I am here to present our study titled Assessing the Need of a Telehealth Support Program to Maintain Exclusive Breastfeeding During the First 6 Months of Life of Infants Born at the University District Hospital of Puerto Rico. This research project is based on the fact that breast milk is the clinical gold standard for infant nutrition. Recent data shows how breastfeeding initiation rates have met national targets. However, goals for any lactation duration or exclusive breastfeeding have not been reached nationwide. Specifically in Puerto Rico, there is no information available about the possible factors that lead to breastfeeding cessation. Furthermore, COVID-19 pandemic provoked multiple restrictions that may affect on-demand feedings and the amount of support mothers could receive from lactation specialists. This study is of great relevance because the University District Hospital is one of the principal institutions in Puerto Rico that provides dignified care at the lowest cost possible for its population, and based on a needs assessment, it has been proved that its mothers need an accessible lactation program. Recently, multiple health institutions encouraged the usage of telehealth for health promotion. Thus, a novel telehealth breastfeeding support program can benefit the University District Hospital's mothers. As mentioned before, 10 mothers completed a needs assessment at the University District Hospital's nursery based on the World Health Organization 10-step guidelines. It revealed that the hospital follows some of the guidelines but not all. Most mothers stated they received orientation about lactation and that they were able to have skin-to-skin contact. However, only one mother was able to breastfeed during the golden hour or the first hour after birth. And 9 out of 10 babies were eventually formula fed at the hospital. Nonetheless, it is important to point out that all mothers were interested in exclusive breastfeeding and that most mothers are interested in telehealth. Based on the information collected from the needs assessment, the research protocol began with the participants' recruitment. 14 mothers were recruited at the nursery and all received an educational intervention about the project and breastfeeding. Once the mothers were recruited, they completed 2 questionnaires prior to hospital discharge to assess all information regarding maternal and infant history, together with mothers' initial knowledge about lactation. The population median age was 25 years old, and their mean gestational age was 38 weeks, among a range from 36 to 39 weeks. During the initial intervention, 5 out of 14 mothers knew at least 70% of breastfeeding information regarding its benefits, latch, and breast milk extraction and storage. While infants were at the hospital, only 29% were breastfed immediately after delivery, but all infants were eventually formula fed at the hospital. Regardless of hospital's nutrition, all mothers plan to breastfeed their infants at home, 43% of them exclusively and 57% combining. Afterwards, mothers received follow-ups interventions via telehealth to answer a questionnaire that assessed breastfeeding status and newborns' general health. At this point, only 12 mothers remained at the study. 75% of them were breastfeeding, and from these 75%, only 11% of them were doing it exclusively. Mothers reported difficulties such as decreased milk production, the most common reason, followed by inverted nipple, latch problems, mastitis, laceration, and baby falling asleep before finishing feedings. Furthermore, 58% of mothers stated they did not receive any breastfeeding support from a lactation specialist. Among all participants, 8 mothers randomly selected also received educational interventions to discuss lactation topics, receive support, clarify doubts, and keep record of their breastfeeding status. All mothers stated that telehealth was an effective tool for their breastfeeding journey to clarify doubts and learn more about the process. Then all data was analyzed descriptively as we have discussed. Important to say that all of this is part of an IRB approved ongoing quality improvement project at the university hospital. Results suggested that the university district hospitals need to reinforce their protocols to ensure successful breastfeeding practices. Also, they showed mothers were confident to breastfeed their infants but encountered difficulties hindering their abilities to breastfeed their infants without support from a specialist. Likewise, they showed telehealth is a feasible alternative for mothers to receive support, education, and doubts clarification about the lactation process.